It's not live. Hello. Really, hello and welcome to the Health Tech Talk Show.
We are live in Las Vegas.
Live once again at the Health Conference.
Yep.
And yeah, wow.
Only a few technical difficulties this afternoon. Morning.
So far.
Only one missing guest. Don't worry, we found other ones. Like Kristen.
Yeah.
Valdez, CEO of Be Well Health.
That's right.
Be Well Connected Health. That's
yes.
Right.
And we invited Kristen urgently because she has a big announcement today that came out on the wires.
Yeah,
we love the wires.
The wires.
I don't know what the wires are. I have to figure this out, but they seem very cool.
It used to be like a thing. Now I think it's just like we publish your press release on the internet.
Yeah. Well, congratulations.
Thank you.
Yeah. So tell us. So
Google, almost like consumer-focused companies have a role to play in healthcare. What?
Is it finally the time? Is it finally time?
It is. It is more the time than anything I've ever seen, and I am here for it. So, as you know, health tech ecosystem announcement, pushing for consumer-mediated exchange, pushing for beyond access to portability, like actually moving our records. I know, it's wild. And now we have the Samsung Healths and the Google Healths and the consumer-facing big tech, no tech debt in that mount, right? Coming live and saying, we think we know consumer. We think we have a role to play in healthcare, and at Be Well, we're just here to power it. We do the really unsexy part, but we're very excited about it. Consumer consented with the right to revoke health information.
So what does this mean as Kat McDavitt, random patient? What happens to me now?
Well, that is actually a story that we're going to allow Google to tell, and they will tell it. They will tell it sometime coming up.
Okay.
But what it does mean is that
they didn't call us, so
call us, Google.
Yeah, where are you?
Well,
You have all my information.
I'll send a page. I'll send a page. But
you already have all my information.
Google, like many other tech companies, did pledge in the health tech ecosystem in the conversational AI category. So you can only imagine what they might be able to do with contextually aware personal information to improve and create simplicity, ease, and convenience. And as you can imagine, they, like many other tech companies, have wearables and sensors. So they're not just focused on the average 2.4 times a year someone goes to the doctor, but health. Because guys, health is bigger than an EHR and a payer system. I know. But imagine all of that contextual awareness in real time, creating convenience for people. Like, health agents in your pocket. We've been talking about them. Are they here? I guess we'll see.
It's unclear.
I guess
I haven't seen them in my pocket, but have you?
Yeah. No, I mean, not really. I also stopped using my Apple Watch, so I'm not a good example. But one thing, I know you don't like to brag, but I do think you should talk a little bit about the scale and scope of Be Well as it relates to payers, because I don't know that people generally really understand the full scale of what Be Well is doing today.
Well, I think we talk a lot about clinical data exchange, right? And we talk about the networks, national networks, TEFCA, HINs, HIEs, and where Be Well has a unique advantage is that we spent 5 to 7 years, because by the way, there's no fast tracking that, onboarding one by one to every payer and provider and lab and pharmacy and Medicare and the Veterans Administration in the country, all with the intent of consumers being able to pull their entire health information. So we have 2.2 million providers, 340 payers, labs, pharmacies, Medicare and the VA. So we can actually now pull a longitudinal health record in under 2 minutes. And we are still working on killing the diagnosis we can eradicate in our lifetimes. What is it, ladies? Portalitis. We are going to get rid of portalitis. We are going to, if you can use your face to board an airplane, you can.
We gave up on smallpox. We're just like, portalitis is all we can do.
Well, it's all I can do.
Yeah.
I'm not qualified for smallpox.
Measles, smallpox.
I can't do anything, so I can just have an internet talk show.
Well, I think that we are in this, and I'll just be a little controversial, right? We are in this time where we are going to allow natural monopolies to rise up and control the flow of information, or we can create an open standards community where we can allow people not to spend 10 years connecting the information they need, but being able to innovate on top of that. And we can speed up innovation that consumers and caregivers and parents of kids with rare disease desperately need.
Nice. Right on. I love that. Is a good move. All right. Well,
thanks for
you have to
me.
go back and do business.
Yes.
Anything else you'd like to tell our loyal fans who see you quite often?
Yeah, I would say consumer mediated exchange. We are here for it. If you want to help innovate on top of this great consumer consented data, give us a call. You know where to find us. And if not, these ladies do.
That's right.
Is there anything we should ask your best friend, depending on the day, Matthew Holt, tomorrow on our live show?
You should ask him if he has tried to commandeer the Be Well booth yet.
I already saw on LinkedIn he believes he owns your company.
He staked a claim many years ago because he entered the show floor with his exceptional badge prior to us even being allowed. He took a photograph in our booth and just said, if you've left your booth vacant, it is up for grabs. And by the way, your booth is equivalent to your company. And so I now own
Oh,
Bewell.
no.
And he posted
I
that
saw
on
an
socials
ongoing
a long
thing.
time ago.
I think with Anthony Leon, it was.
Sorry.
Yeah.
Anthony did a good job defending
But
your
please
your
ask.
company ownership.
I will.
Because we came in force, Matt Holt. We have a team of people at the booth, and they're
shit.
getting in early.
Oh, shit.
We will
Throne.
ask.
Gauntlet Throne.
We'll let you know, loyal fans. He's on tomorrow.
Yes,
Amazing.
please.
Amazing.
Thank you so much
Thank
for
you,
having me,
Kristen.
ladies.
Congratulations.
We adore you. You're fantastic.
All right, so we have a new special guest
News
coming up.
Now for something different.
Now for something different. So we have the CEO of Dari Pharmaceuticals here, who we just met via text message 2 hours ago, and she's going to tell us some stuff because we don't know anything.
That is
Introduce
exciting.
yourself,
I
Sabrina.
love it.
Tell
I
our
love
loyal
it.
fans what's
Hello,
going on.
loyal fans. Hi,
All five.
BR fan. Sabrina Martucci Johnson. I'm the CEO of Dari Bioscience, and we're a purpose-driven health biotech focused solely on closing the gaps between promising science and real solutions in women's health. So what does that mean? That means we're bringing out medicines that can solve problems like contraception to menopause to sexual health to fertility, human papillomavirus infections, right, vaginal conditions, basically kind of making her overlooked solvable today, right? So women don't have to wait for the solutions they deserve.
And so we originally heard about you. I think both of us did. At least I did. One of us or both of us. You were in the ARPA-H Sprint for Women's Health. Is that so? Tell us what's going on there. What did you win for? Because it sounds like you got a lot going on.
We do. We have a lot going on, and that was a really exciting opportunity for us because we do innovate broadly across a variety of therapeutic gaps in women's health. And one of the areas that for us is just shocking, that there remains no medical pharmaceutical solution is human papillomavirus infection. So human papillomavirus is the virus that causes cervical cancer. So think about that for a second. Like, what cancer do you actually know what causes it? And yet we have no treatment for it other than surgically removing part of the woman's cervix when it gets to the point where it's like almost cancer, right? And so that's scary for people, and that can have long-term consequences like preterm birth and fertility, right? Just think about kind of what your body's for. So this was an innovation that really speaks to the way we try to do science, which is we look where there's already evidence of promise so we can get solutions to women quickly. And there was a study published almost 10 years ago now in Kenya, using drugs that were well known and well understood to treat other viruses delivered vaginally, and showed it had promise at treating human papillomavirus infection, both getting rid of it when you were just infected, but also even helping if you already had those precancerous changes. And so we brought it in. That's exactly the kind of thing we want to move forward, right? Where we can just advance it through development and get it in the hands of women. Takes money. Doing clinical trials is very expensive. Medicine is the most expensive part of healthcare development. And when it's something so innovative where there isn't anything like it, the kind of funding we got from ARPA-H is amazing. So that was a sprint for women's health that they did. And ARPA-H is a government funding agency really looking to kind of move really important medical advancements forward. So
Hoping it continues.
Yes, don't we all? Yes. And us especially, because we're at a critical point in the program where hopefully next year we will be taking that potential solution into women so they can try it at home and we can see how well it can work.
And it's non-dilutive funding.
It is, which
really
is so
important.
critical. Yeah, so Dari, we're a publicly traded company, NASDAQ, DARE. And so check us out. And so when we have opportunities like that to kind of take the science to the place where then other investors can get excited and lean in, right? The way medicines are developed is kind of funny. Like, I don't think people know, so, like, who pays for them? Really, right? Because most
basic science is funded by the government, then other stuff gets carried forward.
Exactly.
Yeah.
But so there's that, right? So the basic science is primarily funded by the government, which is fantastic, right? That's your academic institution.
That's why you need NIH,
research.
everyone. NIH. You
Exactly.
need it.
NIH is important.
NIH is important. And
We
then
want America to be the best. We have a lot of government fans.
Yeah.
Yeah, there you
NIH
go. Okay,
is great.
so NIH is wonderful. Please support your government. And then there's this whole phase of research that happens with innovation. So people know about pharmaceutical companies because you hear advertisements on TV. they're kind of the last mile. They're the
Right.
last step. So what happens, there's a whole ecosystem of biotech companies,
Yep.
companies like Dare. We're 25 people. We are small and mighty,
Yep.
right? We're not huge.
Similar to another innovative company, Medicines 360.
Exactly. I love Medicine
they're so
360.
lovely.
Yes.
Best people.
They're fantastic.
Similar
and
vibe, similar space.
Yes. Yeah, exactly. Yeah. We're very close with them.
Yeah.
And so that's where innovation, that next step where we take that promising science and move it forward. And we rely on people like investors funding that work. Right. And so, because a long way of going back to non-dilutive funding is really helpful, because it's that funding that allows us to take something to a point where then an investor can say, okay, I'm ready to now put my hard-earned dollars at risk to help make sure this medicine can make it forward to the people who need it.
Yeah, and it's my understanding that in contrast to pure play health tech, right? Biotech generally is extremely milestone focused. Like if you don't make that milestone, forget it. The funding's gone.
Exactly. So the way we think about it is exactly like there's milestones of phases in development. So another
Health tech
not
is more
well
loosey
known.
goosey. We're like, yeah, it looks good, like looks great.
Yeah,
It's not that
and
way
so
biotech.
in biotech, so first of all, so people know, only like 8%, think of that, like less than 1 in 10 of the products that like ideas, that basic science actually make it into your hands as a patient. Right. So very high failure rate, because medicine's hard, right? Innovating new medicine is very complicated. And so it is a very milestone driven investment situation. So they'll wait, like the first human study is a really important thing. That's the first time you've shown it's safe in people. That's a big milestone. But then the kind of studies like we're doing next with the human papillomavirus, that's another big milestone. It's the first study where we're going to look at women who have the infection and show whether it gets rid of it or not, and how well.
Yeah. The first thing you have to do is show that like it's safe, it won't kill people. And then you have to show efficacy of some
that
level.
it works.
Yeah.
That it's worth,
right.
that it's doing what it's supposed to do. Right. And that's what's clinically validated is. So I would also say women, any women out there, healthcare consumers, I think ask the hard questions. There's a lot of marketing at us right now as women consumers, right? And we're all about medicine versus marketing and real science, but right? Ask the question.
Medicine versus marketing.
Ooh, I like it.
Yeah, like real medicine, like it's not a marketing gimmick, right? Like scientifically backed. You can't say that if you just have an ingredient that someone showed in some other place
in a
did
completely
something.
different situation,
Yes.
completely different population.
That's like
yeah,
we
it's
should demand more as consumers. We should for ourselves.
Yeah. Interesting.
So what else are you excited about? So you named a bunch of other things you're working on in women's health.
Yeah, so I'm super excited. So we have a product that we're very excited to put in the hands of women very soon. We're going to be commercially available, called Dare to Play, sildenafil cream, exactly. So men have had products for arousal problems for decades. Think Viagra.
And they're very cheap now.
They are very cheap now.
Good for them.
Yes.
Good for them.
Yeah. So for 30 years.
Easy to access, very cheap.
Yeah.
Well understood.
And women, by the way, like we actually work the same way. You may not realize blood flow, very important for women. And
testosterone.
So that too, hormones as well. But for a non-hormonal approach, you really look for blood flow. And so that's what sildenafil does. It's the active in Viagra. And we've been innovating a first of its kind cream specifically designed for women, not oral, a cream that she uses on demand in the moment when she needs it, and increases blood flow within 10 minutes. And we've been demonstrating
10 minutes.
10 minutes.
Throw it on in 10 minutes.
Yes, and go.
Throw it on. Stop.
Yeah.
Stop it.
So, or put it on.
Apply it.
Apply the cream. And so we have, we've been working through the studies to demonstrate that it works. And we completed a study showing effects on arousal as well as other like desire and orgasm, other things. I hope we can say this all.
Oh, you can. You can say anything you want.
You can say
That's
anything
fantastic.
you want.
There's
Great.
no limits.
So we've done those studies, completed that phase 2, right, trial, and we're still working through FDA process, but we have partnered with a third party, a compounder. So you probably have heard about compounding, very much in the news, but this is the kind of compounding that follows pharmaceutical grade standards. So yes, so we partnered with them so that women can have access to it now. And so it'll be available via prescription later this year.
Oh, I get it. Okay, that makes total sense.
wow.
Yeah.
Yeah.
But I had heard, I think we had heard, we were discussing before, that you had some you had encountered some
There's a
exceptional
long
barriers to FDA
process.
approval that were
There's
little
a
over the top.
long, yeah. So I would say in general, like when you're innovating in any new area, it's not just women's health, like any new area, right, where you want to get an FDA approval, it's a long journey. And particularly so in a case like this where, think about it, like, how are we going to know whether you use the cream and you have an arousal response, right?
You'd
I
have
got to
to
trust you,
write
right?
a
I got to
report
ask
or
you,
Fill out
right?
your form or whatever. Yeah.
Exactly. You're going to fill out your form and you're going to self-report. And how do I understand what's important to you?
Mhm.
Right. So our view on this is what's important if we're looking at something to address arousal in you is whether you can have those physical sensations of arousal. But the definition of female sexual arousal disorder says that it's a condition that where you have an inability to attain or maintain a physical arousal response and it causes you distress. Just like actually the definition of erectile
Well, I'm not
dysfunction is the same,
distressed,
by the way.
But
Well, and by the way,
I'm personally not distressed.
no, well, right?
Very
But
undistressed
Undistressed.
by the world.
undistressed. And the definition
would
of
fail that
erectile
one, yeah.
dysfunction in men, by the way, is the same. Erectile dysfunction definition
really?
is the inability to attain or maintain a sufficient erection, an erection sufficient to like have a sexual encounter, and it causes you distress. To the
Did
man.
they did the yeah, I was gonna okay,
No.
so
So the ED drugs did not need to look at that
Meet that
as part of
standard.
their
Yeah.
assessment. They basically had to demonstrate that the
I
man
see.
was able to.
I see.
And
I
so
wonder
we're
why.
working through that now. The good news is, by the way, though, when we ask the women, are you less stressed? Are you less guilty? Are you better, like interpersonal difficulties, feeling better? All of those improved. So by the way, they improved.
Yeah.
In our study. But we're working through
That's
that
the sticking
component
point,
of
is like
the sticking
making- yeah,
point
okay, got
is how do we assess that
Yeah.
in the clinical trial? What is the right assessment for that? How should it be weighted versus the physical arousal response?
Got it.
Yeah.
Nice.
Very
So
cool.
so what are you guys here at Health to do? What are you hearing? Who are you talking to? What's the plan?
Yeah, so this is our first time to be at Health, by the way. Oh my gosh, I'm coming every year.
Welcome.
It's overwhelmingly
Yeah, it
fantastic.
is like high drama.
It is
Lots going on.
There's so much. It is definitely overwhelming. So our goal this year, so one, because we are an ARPA-H Sprint for Women's Health awardee, they have a pavilion with some of their partners. So we're there at the pavilion, which is amazing to have that opportunity. But we're here to meet people, to basically build awareness for Dare to Play, Sildenafil Cream, that's going to be available later this year. Make sure we're making connections with other people in the healthcare community.
Nice.
Yeah, so we're really here, network and
Nice.
Yeah.
Awesome.
Here we go. Very
That's
cool.
great.
Well,
Thank
for
you
telling
so
us
much
thank
all
for
you.
about
Oh
coming
my
by.
gosh, I know.
Yeah,
So
we'll be
fun.
linking to all your stuff.
San Diego,
San
California.
Diego.
Yeah, we have
Okay.
an office in Boston as well. So we're in the two biotech
Places.
biotech hubs.
I like
Great.
it. Awesome. So nice to meet you.
Well,
Thank you so much for coming on the show. Thank
Enjoy
you.
the rest of your time here.
Arushi, walk over here. Come here.
Oh,
Well,
we have
Melissa's
an
distracted.
interim 1 minute special.
Interim 1 minute special. Just say hi. Arushi.
Hello, guys. Here.
Arushi, media maven for Innovator, who is doing all the things, and came by to say hi.
Acquiring new fans.
You have to
Oh, my
speak into the
fans?
yes, your
Yeah.
fans.
Thanks. Hi, you guys.
All right.
And ladies. Sorry.
Ladies. We hope it's ladies, but
we
it's
really
not
hope it's
just
ladies.
All right. Okay.
Arushi,
Well,
say one thing
wait, say one thing to our loyal fans.
about what you're doing. What are you doing here?
What are you doing here?
I'm just living in a jet lag, like I always say, but
Exactly.
I'm trying to catch up with a bunch of people who would not respond to emails. Do not quote
If
that.
you
Do not
are
quote
watching
that.
this, you have not responded to Arushi's email. Respond to
coming
her
for you.
emails. She's coming for you.
So
Awesome.
join us for the happy hour.
Join
today
us
evening.
happy hour if you're here. If you're in Vegas, no badge needed. There you
Well,
go.
I'm no badge.
That's right. Thank you, Arushi.
Thank you, Rishi.
All right.
All right.
Next
Now we have
guest.
Dr. Vemireddy. Badge.
Oh,
Badge.
she can wear a badge
Oh,
if
you
she
can wear-
wants
I guess
to.
you can
She
wear
can
your
wear a badge.
It's fine.
She can
It's
do whatever
fine.
she
It's
wants
fine.
to do.
Yeah.
I'm very bossy.
All right.
That's not a problem.
Well,
This is yours to
welcome.
hold. This all you
Okay.
do is just hold it.
Welcome to the Health Tech Talk Show.
hello.
We
Nice
probably
to
we
meet
have
you both.
definitely hundreds of fans watching us right now. So,
Awesome.
Dr.
Hello.
Vemireddy, would you introduce yourself?
Yes, Madhavi Vemireddy. I'm the CEO of Cleo, and I am a physician by training, and I'm also an active caregiver.
Nice.
Oh, so
Yes.
tell us about Cleo.
Yeah.
Yeah, so Cleo supports families across all stages of life, from pregnancy, parenting, toddlers to teens, taking care of an adult loved one, your parents, and trying to take care of yourself throughout it all. So we sell to employers and to health plans, and so they offer our services as a free benefit to their employees, to their members.
Nice. So what does it look like in terms of like, what is the experience for a patient or a family member? What does it actually look like?
So every member that joins Cleo, they tell us what's going on in their family. Are they going through a pregnancy journey? Do they have children? How old are they? Are they taking care of their parents? And what are they taking care of them for? So maybe they have a parent with dementia or had a cancer diagnosis, or maybe they have a child with autism. And every individual gets matched with a human expert that is dedicated to them throughout their journey with Cleo. So they really understand what's going on with the family. They understand what's happening with that member, what their needs are. And our goal is, how do we support them, provide them coaching support, concierge support. Maybe we help them find childcare, or maybe we're helping them find a home care provider for their parents, or other community resources. And one of the biggest challenges we're seeing is that many caregivers, they don't know where to go for help. Many times they're struggling alone. So we see significant burnout, especially sandwich generation, and majority of caregivers are women. And sandwich generation, they're in their 40s and 50s, so they're going through menopause. They're struggling with their career, like, how do I juggle it all? And essentially what's happening is either they're taking a leave of absence, they're leaving the workforce, or they're simply burning out, right? And now this is impacting their health. You see higher hypertension rates, higher depression rates. So it's a significant impact to women's health that no one talks about, because they don't see caregiving, on a clean line, right? Employers don't see it,
Right.
and so
Well,
that's a challenge.
So tell us. So you're selling through employers
And health plans.
and health plans.
Yes.
How does this actually reach caregivers? How is it reaching those beneficiaries?
Yes. So employers, when they purchase Cleo, they introduce Cleo as your family front door. If you're planning a family, or you have a family, or even if you don't have your own kids, you're part of the family, right? Join Cleo. It allows you, even if you don't think you have a need today, it allows you to, one, establish that relationship, have that trusted relationship, really understand, even on a preventive perspective. Like, we all have parents, but do we really know what matters most to them? Do we know if they have an advanced directive? Do we know, like, what are those warning signs? Like, oh, my parent could be at risk for a fall. Right. So it's like, how can we be more proactive about planning for long-term care and really advocate for our loved ones? So we're not just putting out the fires when someone had a fall, or our child is sick.
Right. The issue of like who pays for this is an important one, because it certainly affects the individual. In the way that our healthcare system is structured, the individual is the person who is either employed or insured. But then the other things that are outside of them, including other people who are not insured by that group,
Correct.
are what affects them. So how have those conversations been when you're talking to employers or insurers to help them understand, like, no, you should care, like, we're going to pay for this platform that is going to touch and affect people who are not your employee or your insured?
Right. It's an excellent question, because when you talk to benefit leaders, they get it, because they've either experienced it themselves. So everyone believes, yes, this is the right thing to do. Like, we see it on an anecdotal level of individuals struggling, or women leaving the workforce because of caregiving. But the other thing is, we connect the dots to say, this is a major health issue, right? Caregivers, they are burning out. That's essentially resulting in significant mental health strain. So they're having early symptoms of depression and anxiety. They're not focused on their self-care, so they're not seeing the doctor, right? Because they're putting their career, their family first, their self-care last, and that's impacting their physical health, their mental health. And then so that's on a health perspective. On a business cost perspective, if you're actively caregiving and you've got a lot going on, then you're not productive in the workforce either,
right? You're missing days
Right.
from work. You're distracted, or you're trying to find the right resources for your family while you're at work. So that there's significant productivity loss, especially for those caregivers that are at high risk of burnout.
Nice.
And then leave of absence, right?
Sure,
All
sure.
the benefit leaders have
Sure.
been seeing a significant rise in leave of
Yeah,
absence,
for sure.
which has a significant cost as well.
Yeah, how many choices do you have?
Right, agree. You know, I we've been talking a lot about on our regular Friday show about the whole like who's responsible for a social safety net, and like Lisa's saying, like these aren't necessarily covered beneficiaries, right? But
Right.
they're impacting the beneficiary,
Right.
impacting the employee. So
Right.
it's super cool. So I assume your own experience as a caregiver
Yes.
is one of the reasons that you decided to
Absolutely.
start Cleo. So tell us about that. How did you? Because are you still practicing?
No, so I'm
Okay, okay.
not practicing. I've been in digital health for 25 years.
Ah.
So I'm trained as an internal medicine physician. And I was building population health programs, advanced analytics that were all aimed at the patient, right?
Mm.
How do I prevent someone from developing diabetes? Or if they have diabetes, how do I make sure they're well controlled, right? With lifestyle, modifications and making sure they're on the right treatment plan. And so during that time, I had my two boys. I have a 15-year-old and an 11-year-old. But with my eldest son, when he was born, he had a rare congenital heart anomaly. Didn't get diagnosed for 6 months, and he wasn't growing, and we
Sure.
couldn't figure out what was happening. He ended up having open heart surgery at 9 months. That fixed the heart issue, so he started growing. We're like, oh my God, great, we saved him, right?
Yeah.
And he was catching up. And then at age 5, he got diagnosed as being on the autism spectrum. And I'm like, how's this happening? And even though I'm a physician, my husband is a physician, we struggled. We're like trying to piecemeal together this plan for him. What are the things we need to do? And I think, you assume like your pediatrician has all the answers, but they don't.
Yeah.
Right? You have to really was talking to other parents, and I'm like, oh, you're doing this therapy. That's interesting. Or you're doing this for communication, right? So it's really helping to connect all those dots. And then when I had my second son, I was 3 months postpartum, a newborn at home. My father-in-law got diagnosed with terminal brain cancer. He
Wow.
was on his 50th wedding anniversary
my God.
cruise. And so we went through a 9-month journey with him from diagnosis to death. And we were navigating everything about end of life, palliative care, hospice care, finding a 24/7 in-home care provider, getting his will signed, supporting my mother-in-law after after he passed away. And I'm like, why aren't we not supporting our caregivers? They are all trying to figure it out by themselves, and it's a significant strain. And it was like, we should really apply our population health framework to caregiving. Because there's so much,
It's really interesting.
such a significant health risk. It's not just about, let me help you get the resources in
Sure.
place. How do I make sure that you are doing well while you're going through this journey? And so that's how, we started a company called Care Tribe. That company was acquired by Cleo almost
interesting.
3.5 years ago, because Cleo started in maternity. It was also co-founded by a physician, an OBGYN.
Nice.
And then during the pandemic expanded into parenting. And then, we were asked.
Very cool.
Yeah.
Caregiving
And then we
stuff,
were asked
yeah.
by our benefit leaders to say, well, wait a second.
Okay, you're
I have a
supporting it.
multi-generational workforce. So it's great. You're supporting my younger employees that are early in parenthood. What about my employees that are in their 40s and 50s with older kids, taking care of their parents? And so that's why Cleo brought in Care Tribe, so that we could provide end-to-end support across all life stages. And we do it at a global level too.
Oh, wow.
Yeah, we have our guides in 19 countries,
Wow.
and we support members in over 70 countries today.
Oh, wow.
And one of the things that we're finding is, because in certain countries like India that have a significant aging population, like the sandwich generation is 2 times what it is here.
Yeah.
And much higher risk of burnout, much higher risk of mental health strain. And then you have stigma. There's the mental
Right.
health stigma, there's the mother's guilt.
Right.
So
Right.
anytime anything, goes wrong, like a child is sick, or, there's a parent is declining, there's pressure on the woman of the household to quit her job. because it's like it's your responsibility.
Yeah.
Right?
For sure. I just watched a documentary, maybe you've seen it, it's called Prime Minister, about Jacinda Ardern. And she was the young woman prime minister, had a baby while she was in office.
Yeah.
And there was a huge amount of blowback, even in New Zealand, which is a super progressive country,
Yes.
about her husband being the primary caregiver. Just the expectations are everywhere, and they're still so
everywhere.
huge.
Absolutely.
Yeah.
Absolutely.
It's so interesting.
What is your largest market by members? Is it India or is it the US?
It is the
Global
US.
market, yeah.
Yes, it is the US, but actually India is second.
Wow.
Yes, and then
Very
Canada.
cool.
Yes.
Nice.
So like 40% of our customers today are US multinational companies.
Oh,
So
interesting.
not only are they striving for equity across their generations, but they're also striving for global equity.
Yeah.
Right.
Interesting.
How do your clients, the plans, the employers, how do they measure your success? Is it by satisfaction or what?
No, it's-
Costs going down? What's the move?
There's definitely the qualitative measures, like are the employees happy? We have high CSAT scores, like 4.9 out of 5. But we're talking about health, right? So we measure a reduction in the burnout risk. We measure improvement in their actual PHQ-4 mental health screening scores. We also measure improvement in their productivity, metrics. So, increase in total productivity hours. What we see is about a 70% decrease in burnout risk after 6 months of working with our guides, and getting them the right resources. So we're decreasing their caregiving burden. And when we see that decrease in that burnout, their mental health scores improve, but we see almost up to 100 hours of time saved, right? Because of that improvement.
Yeah. So what are you guys doing here at Health? Like, what's the plan? Who are you talking to? Why are you here?
Well, so we're here. We have a presentation coming up soon,
great.
talking about the multi-generational workforce
Great.
and really driving more awareness to caregiving. I think there's so much stigma related to caregiving today.
Yeah.
People don't, only like half of the caregivers actually tell their managers
Oh, interesting.
that they're caregivers because they don't want to be seen as distracted, right?
Interesting.
Or less focused.
Yeah.
And I think there's probably worry, that they're going to be passed for, promotions,
It's the
right?
same thing like coming back from maternity leave, right? New mothers they want to make it sound like they can do it all. Because,
Exactly. Yeah, exactly
even
right.
though you don't sleep and nursing those babies.
Well, that's right. And so we have to, and we have a crisis
But
today.
as a former people manager, or current people manager, I guess, unfortunately for me, it's so hard. Sorry, it's bad. It's hard work. It's hard work being a people manager.
It's hard work.
It's very hard.
Rewarding.
I had so many situations where employees had caregiving issues, or just came back from maternity leave or whatever.
That's right.
And quite frankly, I think a lot of employers and people managers in particular are like, I don't know what I can do to help you. Like,
Right.
You're like, I don't know. I don't have any resources to provide you truly. I mean, most companies are just like kind of making it up, right?
Right. Well, and that's where Cleo comes in, because it's like, I have a solution for you no matter where you are in your life stage, no matter who you're taking care of, your parents, your children, yourself. You're coming back from your, pregnancy journey,
Whatever it
postpartum,
is.
you have a newborn. We'll help you with how, newborn support. We'll help you with a lactation specialist. We have sleep coaches. We have nutrition specialty areas. So we cover over 30 specialty areas.
Interesting.
And we're really the extension of like the care you're getting from your physician, but it's all the areas that it's not really part of the care delivery system, right?
Right.
That either you're trying to go find those resources on your own or you're doing without them.
Yeah.
And so we bring that all to you in a very holistic manner so that we keep you in the workforce, staying productive. And like I have this, person that I can trust, that when an issue comes up, I can easily text, get on the phone with them, get the right answers that I need to feel confident about what
Awesome.
I'm doing. And also to, constantly remind me that I have to focus on myself, right? And my own health and not feel guilty about it.
Awesome. Well, thank you so much for coming on the show.
Last statement
We
for our
are
millions of
any
loyal
last
fans?
statements for our millions of loyal fans?
Well, I would just say, let's talk about caregiving. Let's realize how all of us are impacted by caregiving. And let's bring in a solution like Cleo to support your families.
Awesome. Thank you so much.
Thank you.
Thanks very
Pleasure
much.
to meet you.
Yes,
Pleasure to
lovely.
meet
Yeah.
you.
Nice
Yeah,
meeting you.
good luck with the session. Good luck Thank with you. the rest of the conference.
All right.
All right,
Cleo.
we got
All right. We got.
You're up. Oh my goodness.
You're up.
We have been told that you are a very interesting individual generally, in addition to having a cool company.
Well, I like to think I have a cool
And a
company.
pocket square.
The interesting,
a-
anyone who has a pocket square has got to be interesting. I think we all know
this guy,
this.
this guy's right for the show.
Yeah.
All right, well, Donovan, so introduce yourself to our loyal fans. CEO of Medbridge.
Yes, Donovan Campbell, CEO of Medbridge, and yeah, we are a company that makes care software to extend conservative care to more patients, and we do that through enabling providers. So I can talk more about it, but
Yeah, what does that
That's an
even
intro.
mean?
I know, right? There's a lot of jargon there. So basically, what it means is there are not there. Well, I try. The biggest problem I think we face in healthcare now, there just aren't enough clinicians providing care. Period. The end. That's going to get worse as
Yeah,
America
totally.
ages.
For sure.
We know this. There are also not enough clinicians providing care in the conservative care space, and that may be the single biggest thing that we can do to bring the cost of care down and improve outcomes is get people earlier
What do you mean, like,
into conservative care.
preventive, earlier, lower
Absolutely,
cost
great
things.
example. Lower back pain.
Me and my hip problems is the example
Yeah.
here.
So about
I
40%
should go to
of
physical
America.
therapy. Help me.
Ex-
Someone make me
So
go to
that
physical therapy.
so that is exactly what we do. So let's
Right.
let's take lower back pain as an example.
Lisa's getting
Free
I'm
advice.
Listen, what am I doing here? besides
This is
giving free
important.
advice? This is very
Well, the
important.
important thing to know is I am not a clinician. I have a history major,
Me
so I'm going to be of zero use to you. Just know that. So
Oh, I
lower
know,
back
I
pain.
like this guy. Lower back pain.
In my old job, we were talking to the then chief medical officer of Optum, Richard Migliore, and we said, our research shows that about a third of lower back pain surgeries aren't necessary. And he slapped the table and was like visibly frustrated. We're like, oh my gosh, we're a little
What do
company.
we
At the time.
do?
Like, how do we make this come in? He goes, it's not a third. Like, what do you mean it's not a third? He goes, it's half. And the problem is we don't know which half.
Yeah, for sure.
And that is consistent with all of our hospital system clients. They know that lower back surgery is overprescribed. It's very hard to intervene upstream and stop it from being overprescribed because there just aren't a physical therapist. Like there just aren't. The wait time, one of our large clients, Intermountain, wait time has been up to 4 weeks to get into a physical therapy clinic, right? And you know that after 4
Nobody
days,
even wants to go, so it's like you
Correct.
lose them.
Let
you
me get
lose
to-
me. They've
correct.
lost me.
but many
I'm too lazy.
musculoskeletal issues will resolve themselves
Right.
if you just do
For sure.
nothing, actually. But if you go in,
Aw, Lisa,
yeah.
free advice club. Do nothing.
Not a clinician. It's the
Yeah.
inflammation. Blah blah blah.
I'm not sure I'd recommend doing nothing,
No.
but the point is, if you can get engaged with conservative care and
I'm
stay
a,
out
I'm
of
a,
a pain
I'm a
clinic-
physician, Melissa.
Listen,
Melissa's
you-
looking at me. Just give me a
Don't look at
realistic
Melissa.
guy.
This gentleman is giving you free advice.
I'm
Keep going.
listening.
Keep going, sir.
I'm doing my best. It's hard, but
I understand.
So bottom line
Can't
is,
learn.
if you can get more people into conservative care earlier, because it's just easier and it's more convenient, and like you could do it tomorrow or you could do it tonight, more people will do it.
Yeah.
They don't do that, and so they get too many surgeries,
Right.
and then they have pain pills, all these things. So we make software that physical therapists or orthopedic surgeons or increasingly now primary care clinicians can use to issue to a patient, for example, who has lower back pain, an AI-driven care pathway that will look at you as you do sort of a lower back assessment. It will use computer vision to
Sure.
benchmark your movement against the
Sure.
model. It'll then say, okay, you are a candidate for an intermediate lower back pain program.
Sure.
And it will put you through a progressive, self-paced, guided series of exercises and nano education that can be like 4 to 12 weeks, etc. That is designed to mimic the experience of a physical therapy session, but from the comfort of your living room. And so what we're finding is that in this case, our clients are using us to augment their own care capacity when they
Mhm.
just don't have enough clinicians
Mhm.
to treat the need. And what we find is that like low acuity patients, low complexity patients, even medium acuity, medium complexity patients can be treated really well with software. There's always a human in the loop, if you will, meaning all of the stuff is fed back to their EHR dashboards. There's clinicians overseeing what's happening. They can see the results that are like promise assessments. The results are populating in the EHR. There's a red flag that'll alert them. They can pull the patient in for care. But what this does is basically it reserves the incredibly important human touch for the people who need it the most. And it lets software treat the patients that it can, so that humans can treat the patients that they must. That's fundamentally what like a care platform can do.
Yeah. And so sorry to poke a little bit here, but
Poke away.
you know, how are you different than the big companies with start with H? Like, tell me more about the competitive space around MSK and
Yes.
physician extension.
So a couple of things. One, I think people don't realize that Medbridge has been around for a hot minute, since 2011.
Nice.
And we have about 3,200 clients. We have 9 of the nation's top 10 health systems as our clients, 9 of the top 10 physical therapy private practices are clients. We're in home health. We're increasingly in employer focused advanced
Nice.
primary care. So the
Nice.
biggest difference between us and companies starts with H or with S is that we sell our software to providers.
You're trying to integrate with those providers directly
Yeah.
and be an extension of their
Not
work.
actually carve out and move out. the
Correct.
services.
Correct. Listen, I was in the employer focused health business for a while. It's a great business. Hinge and Swords have done some great things. But we believe at the end of the day, if you want to affect true population health impact, the best way to do it is to work through the
providers.
local
Yeah.
provider ecosystem, because that is the way patients
Yeah.
behave.
Yeah.
Our problem in my old business was population health engagement. You could only get so many patients to engage when your way of reaching them is somewhat unnatural to the normal care journey, i.e. the company's HR department sends out a marketing flyer. You may have phone callers that are on the phone
Love
saying
that.
like you're capable
Love that.
of coming into this employer sponsored benefit. We'd rather sell to the existing provider
Yeah.
ecosystem.
No, I love that, because I think that we've lately been talking a lot about medical mistrust. There's just like mistrust in general in America right now, and one of the big the shining points are community physicians, independent
Absolutely.
practices that have been able to stick around. We always talk about the great state of West Virginia and their independent pharmacists as one example, where one of the reasons they had such an initially very high vaccination rate was because the community pharmacists, who are not chains, it's one of those states, would just drive around because they knew everybody. And so I love this idea too, that that's a
Yeah.
way to keep patients engaged, because that's who they're used to dealing with and who they trust.
100%. And so our job is to enable them to do their jobs better. And what we're finding is some of our more advanced clients or advanced systems are starting to stand up their own H or S like competitors. And the value proposition is straightforward, right? Contract with us employers. Not only will you get access to a high quality, fully digital experience powered by our own physical therapists, but also we have 80 clinics in the state. So if someone needs to be referred to local physical care, we can totally do that.
Yeah.
That's a pretty good value proposition. Now it's early innings for most of them,
Sure.
because it takes health systems a hot minute to adapt to technological innovation or just different service models.
Yeah. Interesting.
But I don't say a lot, but a number of them are now starting to do that.
Yeah, in particular, the employer pathway you were just discussing, it's so challenging. I've built marketing campaigns for employer
Yes.
solutions, and it is just like, you're like, yep, make sure you put it on the cork board, in the break room, which doesn't exist anymore. You know, like just put it on the portal. Exactly.
That's exactly right. It sounds like,
at your
1940 called
solution.
and like its employee
Yeah,
engagement,
yeah.
model back. Yeah.
So are you mostly dealing with MSK, or are there other conservative
Yep.
care stuff that you can do?
So our roots are in MSK, and just of note, we have 350,000 plus providers that use our platforms.
That's
so
awesome.
So
I know it feels good. Like
Yeah.
we're a smaller company in a niche, but we're breaking out of that niche. And the goal is to use the expertise we've gathered over, the last 15 years or so to build new and intelligent software to help more people. So we have in the progressive care portion of our platform. So we have traditional home exercise programs anyone can use.
Yeah.
Those can be remote therapeutic monitoring enabled. That's important these days. But in the progressive care pathway, the one I shared with you, or the progressive care portion of our software, we have musculoskeletal and joint pain as a program. We have pre and post surgical programs for total hip and total knee.
it's gonna be me soon. Total hip.
Let's not be dramatic.
Wrong show, my
We
friend.
don't know this yet.
Options, Lisa.
Wrong show.
Conservative care. Conservative care. Physical therapy. I can't emphasize this enough.
She wants to skip to the end.
Yeah, no, you don't want to hip
No, I
replacement
don't. I
if
really,
you
actually
don't.
really don't.
You don't
I'm
have
good.
to.
I'm good. Anyway.
Women's health, so pelvic health, pre and postpartum, as examples, perimenopause, menopause programs. We have occupational health or injury prevention. And then we have what we call our senior care program, which mainly focuses on fall prevention in elderly adults.
Nice.
And all of those are up and running with a variety of different hospital systems in general.
Very
Nice,
cool.
nice.
And integrating into the EHR, like wow.
You have to integrate
Yeah.
into the EHR. If you don't integrate into the EHR, number one, you can't get clinicians to use it. A
Yeah.
frontline clinician cannot go through yet another set of clicks
Right.
with a solution that's supposed to help them with burnout, but actually is now adding to it because they got to do more stuff. So we integrate into all major EHRs. So because we don't work if the frontline clinician doesn't do their job well, like period, the end. They can't resist our software with the patients, or they're not using the patients to get better. So yes, it's integrated into the HRs, and that's sort of where they feed, that's where they prescribe programs to patients, and all the information is fed back into there, so they can see how their people are doing, and what they're doing at home. And by the way, this is a window into patient behavior they never had before.
Interesting.
Like, does your doctor know if you're doing your exercises at home?
No.
No. Do they know if your pain
You
is
can just
getting
assume you're not
worse?
doing it.
Correct.
If you're me.
With this way, they can know what they're doing. They can know how they're doing. We've got some pretty cool, like, patient-facing AI coach features that are coming front half of next year, and a clinician-facing AI assistant that's coming front half of next year. We've got an AI triage, like chat interface that's in beta right now. That's enable, for example, advanced primary care companies who aren't necessarily comfortable triaging people with MSK to feel really good about, hey, this person is fine for a pathway. This person probably should be seen locally. This person may need to go to the EHR.
But you make such a good point about that, though, because I mean, one of the like nightmares of our professional lives is the lack of interoperability in systems.
Oh,
Like
it's the worst.
it's so stupid. We're in a stupid place now where we're like, how many more dumb things can we do that are not truly integrated into the systems? And you're really making me think about those other companies and sort of the narrow pathway towards action that really takes the clinician and the provider out of that circle. And it's like, well, if you were a doctor, I know you're not, would you be like, what is this thing that this patient is showing me on their phone? Like, how do I know what this is?
What are they doing?
What are they doing?
How are they doing? I have no insight into that. So again, they've done some great things in expanding access. Good for them. But I think the best sort of care is where you combine local access, local care with like digital enablement. We call it hybrid care, right? I mean, fusion of digital and physical, and increasingly the fusion of AI with the human touch. I think that's another component of hybrid care that is coming online, and we should pay a lot of attention to.
Nice.
Very cool. Very cool. So what's next?
Yeah.
What do you stuff? Got the AI going.
You hear health.
The AI
The
going.
AI.
Yeah. Well, that's no trivial thing. So to get that right, where you're actually using artificial intelligence or generative AI, that's what we mean generally now when we say that. Generative agentic AI to make the patient experience better, or to actually really give the clinician an assistant and helping them provide more care. That's not trivial. Right now, most AI use cases are essentially back office automation.
Right.
Can you give me a good dictation tool? Can you automate my RCM
We had
cycle?
one guest talk about it being like a toaster.
AI like a toaster?
Old timey. Yeah, like automatic back end processes, and it was not real AI.
Well, I mean, look, there's something you said for automating
I don't know what she's
back-end
talking about,
processes. I don't know that I'd call that a
I have no
agentic
idea what she
AI.
means.
Remember that guy? I forget what his
No,
name
I
was.
don't
The
remember
guy?
that guy. She made it up.
Yeah, I don't know.
We
the guy
don't
either.
know. Yeah,
I'm not
see?
sure. I don't
See?
think he's a real guy.
2 against 1.
Maybe like a leprechaun. Anyway, I think the best use case for agentic AI is to augment the care capacity of the United States.
sure.
But that's freaking hard to do.
Yeah.
And there's a lot of regulation
Yeah.
around that. So that's where a lot of our energy is going right now is
Nice.
using what we already have and the knowledge we already have to provide a high quality experience, both for patients when they're dealing with a patient facing coach, and for providers when they're dealing with an AI assistant that's actually making their lives easier versus making them do a whole bunch of stuff or undo a whole bunch of stuff that AI does.
Yeah.
That's what
Nice.
we're squarely focused on right
Nice.
now. Yeah.
Awesome. Any final words for our millions of loyal fans, which we're sure we have?
Yeah, of course.
Would love to, tell us, what you're here for at Health, and any other final words for our loyal fans.
Yeah, the only final words I would have are this, get conservative care. Like, do your best to go in to healthcare early. Don't wait, because at the end of the day, too often we see people who wait end up with really terrible outcomes. Take care of yourself. Take care of your metabolic health. Sleep enough. Modify your diet. Get conservative care. That's what I would say. Like, that's what matters.
We should have started with this. How'd you get into this?
I have a somewhat
I see
non-traditional
you got
background.
you got a
Yeah, so I actually joined the Marine Corps right out of college.
Ah.
And so I did a couple Iraq tours and then Afghanistan tour, and then eventually made my way to healthcare. I joined PepsiCo after the Marines. I went to business school, joined PepsiCo, and then after a while I was like, I'm not sure that I want my life's work to be feeding America salty snacks and soft drinks. I just didn't know that that was what I wanted
The vibe.
to do. Yeah, so through a series of just fortuitous happenings, I ended up moving into healthcare. I'd had some technology experience by that point in time. At a small company that was called Second MD at the time. It was one of the first to bring, call it live video, live voice to the second opinion space and provided a superior experience.
yeah.
So we grew that from very small to about 60 million in top line revenues, and then sold it. And I had to stay on for a couple years after that.
Wow.
And then I had this opportunity to come over to Medbridge. It's kind of this,
Nice.
good but somewhat sleepy physical therapy education company, but we're doing 15 million home exercise programs a year. Like, that's not trivial.
Solid.
So we're able to build on that, to build sort of a new care platform that's now being rolled out to all of our
Nice.
clients. And
Nice.
it's been fun. I can't complain.
And
That's
where'd
awesome.
you beam in from? Where'd you fly in from?
I beamed in from Houston. Yeah. Unfortunately, my beam was about 30 minutes late this morning, but that's just the state of
That's great.
it's
That's
the
what it
state of
is.
air travel these days.
You got to
for
volunteer to be
sure.
an air traffic controller, right?
Yeah, we
Yeah,
they need help.
It's community
They need
service
help.
now right now.
need
Thank you,
help.
air traffic controllers. We appreciate
And
you.
Melissa, our air
Please.
traffic
And
controller
Melissa,
for our
yeah.
show.
Thank you
Awesome.
so much. We
Hey,
really
you guys-
appreciate it. Yes,
Pleasure
thank
to
you.
meet you.
Thank you.
Next time we'll hear about all
Pass
the
it
cool
on
things
to
your
the
team
next
told us
guy.
about, which we didn't hear about yet.
Awesome.
We had a
Next
good time. and that's
Thank
what matters.
you. All right.
Thank you guys.
Final guest, I think.
Yeah, final guest of our first show at Health.
Hello.
Yeah, so I met Carey randomly in the hallway. Bluebird Health Partners.
Yes,
Just
ma'am.
now?
No, like
Registration.
yesterday.
Like,
Like
We're
yesterday.
at registration at the exact same time.
Yeah, and it was serendipitous. So Carey, so tell our loyal fans who you are, what you do, and why you are here.
Yeah.
So my name is Carey Hendricks. I'm the managing partner of Bluebird Health Partners. We're a healthcare strategy execution firm. So all of this great conference, all these great solutions, navigating from I've got a really good product to actually improve patient care, right? The discussion you guys were just having. Navigating that roadmap
For
from
sure.
where they are to improve patient care is extremely complicated.
Yeah.
And so our model is kind of a fractional executive, product manager, project manager, dedicated on just that strategy to really get you, to improve patient care.
All right, very cool. And you're from Florida. Do you work everywhere? Are you Florida centric? What's the
So
story?
We're still very new. So
Okay.
our first focus is in Florida, probably still kind of East Coast. We have relationships up and down the East Coast. I spent some time in North Carolina, spent some time in Virginia. We're working very closely with Georgia. So probably a little East Coast focused, but primarily Florida right now. That's where our network is. So we're just talking about change management from a change perspective, having those existing networks and people who already trust you from all of our experience on the payer and provider side. It's just easier to get the doors opened and easier to have those conversations in Florida.
So what does it look like? I mean, let's say you're working with some founders, they have a new idea, a new product. What does it look like from there? Like, how do you move them forward in there? What do they not understand? What do they think? So I'll tell you one thing I heard, just as a side note here, someone saying like, well, I mean, we're gonna improve this by X percent. Like, all the hospitals are gonna say yes immediately. And I was like, no, they're not. No, they're not. Like,
I had a call-away conversation yesterday where a gentleman told me that he was this week planning for how they're going to take their solution from 13 hospitals to 2,000
in 5 weeks.
in 2026 alone. And I was like, God bless you, sir. If you do that, you'll destroy
I
your
salute
delivery
you.
team. So
God bless you.
Say
God bless
more. Yeah,
America.
right. Like, good luck
I mean,
to you,
yeah.
sir. Like, that's what
We'd be
I
lucky to
hear.
go from 13 to maybe 15,
15, yeah.
18, like
It's gonna be
that would
13 to
be a
15.
good- that would be a good win.
Right. So say more about, like, because you've heard it a million times, we've heard it a million times, like, but our product is better. Why
Yeah.
don't they immediately
is
up?
best.
Yeah,
It's like the talk show. Our
Right.
product is
Our product is better.
but we are still broke.
So
Say more about that.
so one of my objectives this week is figuring out who's investing in innovation.
I
So I think we've got to get to
Nobody.
right. Well, some people. So in a world where the government is pulling back funding,
yeah, right,
payers are
real,
pulling
real.
back funding. Who is it going to be?
Yeah.
And in my opinion, it can't just be private equity.
Sure.
So we've got to
sure.
start tracking back. And it's nice that this week there's a focus on employers, because I think
Yeah.
who's feeling the pain is who you got to get to.
Right.
Because that's where you're going
Right.
to get to the funding. So helping them build that story that says, hey, this is why we can help you. we were working with one client who they had 28 slides in their pitch deck and they didn't tell a story. And so we said, okay, like let's lean back into here's who you're pitching to. We know enough about their ecosystem, about their pain, but let's figure out what's the ROI. We know, right? It's going to be a business case, which means you got to have a clear return on investment, but we've got to figure out how do you tell your story so that the buyer, right? Because that's the unique thing about healthcare is we're not a business to consumer. The patient doesn't buy healthcare.
Sometimes.
Not really. The
A little
health
bit.
system buys it. The payer buys it. It's too opaque.
It's very
right?
small, a
Patient.
very small amount of patients buying what we'd consider healthcare, but like very involved, directly involved.
Well, women's health is a pretty good
Yeah.
industry for the individual buyer, right? The consumer, which is something that needs to be solved by the folks who are at this conference, is helping women to navigate that. That's my personal life. Is my wife trying to navigate women's health is a nightmare because it's not an invested, ecosystem
Mhm.
that women can easily navigate. So I think we got to figure that out. But it really comes back to who's the buyer. How do we connect that solution to the person who would buy that solution? It's kind of where we need to.
Nice.
bridge.
Nice.
Carey, does the best product win?
You need a good
No.
product. So we have to get to a point where
Good enough.
it has to be good enough. Is it the best? What we really look for, so that's actually part of our value prop, is that my team is from the innovation groups at the payer. So we've seen all of the products. We can tell you, where are you in the market? So that was my other question for this week. When you say, is the best product going to win? Maybe, maybe not. I think there's actually a session here that says, if everything is AI, then nothing is AI.
Yeah.
So there's going to be what?
That's a good title.
10,000 AI solutions.
I support.
Yeah. It's
Oh, I
just,
just left
it's just
one.
the new thing. Yeah, you just left one? Tell us more.
Where they were, AI, and that's what we're going to hear all week. But do you have a care program that's wrapped around that AI solution? I think AI enablement is a requirement at this point in the industry, but is it a broad enough care program that you're actually delivering improved patient care through AI, or do you just have a really good algorithm? I don't know, how do we get to, is it the best product? Probably not the best AI solution, but is it the most comprehensive care program where you can actually target a patient, you can actually tell that story?
Yeah.
Those are the groups that we like
And
to
most
work
people aren't building foundation models, so they're just like theoretically have better access to data where they've been training something, developing a small language model to go along with a large language, like whatever it is. Like there's not a lot of differentiation there necessarily.
100%.
So back to what you were saying about innovation, right? It can't be done by just private equity. Even like we've heard some stuff, and I think we've both spoken on panels about, could it just be philanthropy? Could philanthropy fill the gap? No, it's a lot of money. What is this? What is the solution? Do we just wait?
I'm curious if it's consumerism. So my best answer is, my whole career, we've been talking about consumerism in healthcare.
For sure.
The Affordable Care Act is supposed to really drive us towards consumerism. So my question is, are we going to be able to advance consumerism where the patient is making the decisions, where they're navigating care, they're determining, and then does the market respond to that consumerism? So do we start to see where, evidence-based outcomes become something that the patient makes a decision on instead of, their doctor, or the payer makes a decision, right, on what care is appropriate for that individual. So I think you might see some consumerism come through.
I just think there's such an illusion of choice, and that choice is for so few people, right? Like when you get into people feeling constrained by their health insurance networks, which are getting narrower and narrower, where there's so much fake access, where somebody's theoretically in a network but isn't actually available, or is only seeing, like, there's a big thing about Medicaid coverage and the number of providers who are actually seeing Medicaid patients, and they'll be like, oh yeah I am, and they have like a spot on their calendar for one patient visit a month or something like that. So like there's so many like fake networks, there's such a fake thing of access, so only a very few number of people really have any consumerism choice for health care. Now when you get into the like outside world of that,
Longevity.
then it gets a little fuzzier.
Vitamins.
Yeah, vitamins or whatever. Like then the people get kind of pushed into the fringes because there is so little access at the core. So I think will always be a challenge or a barrier to more real consumerism in healthcare.
The other big challenge is cost transparency. So a couple years
Absolute
ago,
joke. No, it's genuinely so
No,
bad.
it
It's
really
genuinely
is.
such a joke right
well,
now.
because even every other reason aside, you don't even know how is your doctor going to code the service that they provided.
Correct.
Yes.
So
And
there
I've had to fight them on that. And by the way, the insurance company doesn't care.
Right,
Even you're like,
exactly.
They don't care.
coded that incorrectly. They're like,
Exactly,
Whatever.
exactly. So maybe value-based care can help us a little. I remember years ago there was a kind of a gold standard. It was out of the Tidewater area of Virginia, had this price transparency tool. But you would have had to know how is your doctor going to code,
for sure.
even if you wanted to use that tool. And
And good
don't know
luck,
if we're
good
gonna
luck
get there.
advocating on that front, as I've tried to do, because they genuinely don't care. The levels of, it's not that the individual doesn't care, but the system doesn't care.
Yeah.
Like if you try to be like, this was coded wrong, they're like, let me put that into the, no one cares. Like there's just not like there's not a pathway for being like, you coded that wrong and it matters for the amount of money that I'm going to pay after my insurance covers X, Y, and Z thing. It matters.
Well, super good point, because the Trump administration also re-upped their executive order on all the hospitals publishing their prices. I'm not sure. Has anyone done it?
Not that I know.
But-
not
to
in
your-
a
not that I know of,
consumer,
yeah.
not in a consumer-friendly way. Right?
Here is a
The
machine readable
concept-
file that you cannot,
Right.
in fact, here it is. So you just
But-
toss it into ChatGPT and you're like, woo, here we
But
go.
to your point, you have no idea how the physician is not going to code. Are they going to even say you did the thing that
That's
you
what
thought you
your
got?
listed service price is, and there are all kinds of considerations for what your bill is going to be. And so, like things like advanced EOB, advanced explanation of benefits. There's some policies that could help, but like it doesn't change that the balance of power there is definitely not to a patient about. They just you don't. It's not your. You don't have the power in that situation.
Right. And you just brought up the administration. So you can think about, we're in a government shutdown, right? We're talking about that all week because there's multiple attendees couldn't come because of government shutdown and all of that. So is it that inflection point? If we say consumerism, we talk about price transparency, like we are also headed to a place where the consumer can't afford healthcare. Like we are
I feel like we're pretty much there.
We're pretty much
Yeah.
there. Years ago, I helped our team implement the ACA when we were first doing the operating model for the ACA. And we were it feels very similar, right? That was very much that similar inflection point where people can't afford healthcare. Well, the ACA will fix it. Now we're reflecting back. There's a lot of opportunity there. But is this government shutdown, could the positive be that we really get to a point where healthcare becomes more consumer focused? You know, we were talking yesterday about $2,000 a month in healthcare premiums. That can't be the model. So we've got to innovate, and whatever the compromise is that comes out of this government shutdown, we've got to be able to leverage that to make things better for the patient, because families can't afford this, and we've got to figure that out.
Yeah, I totally agree. Yeah, love it.
So
Totally agree.
is business like totally booming with all these companies wanting to work with the plans and figure like is it like crazy, or are people freaking out? Like what are the markets like for you?
So that I would say a lot of people I talk to are like, if we had buyers, we're not really focused on business development. And so that's why one of my goals this week is figuring out
To learn
where is that
where's-
funding coming from, because I want to help more solutions connect to the funding. And then once we're able to have that funding, then we can execute. I think that the absence of investment, there's so much uncertainty, right, in healthcare. I think that traditional investors are struggling with uncertainty. And so I think we've got to figure out, where is that funding going to come from for innovation? You know, how do you, one of our playbooks is focused on pilots, because I love small scale pilots, small investment. Our model is also a little bit different, because what I've learned since I've been doing this on, not on the payer and provider side, is that the payers don't need to invest heavily in innovation, because the solution providers can invest in the process so that they open up a new revenue stream. So it's downstream, but connecting all of those dots is very complicated. And so being able to tell that story that, hey, we're going to open up a new market. We're talking to an MSK provider, and they don't have a provider vertical. They're traditionally an employer focused. They do have a payer vertical. But if employers are hard to navigate, if payers are pulling back from innovation, to me, there's a provider vertical there.
It's just like Medbridge. Just like Medbridge.
Oh, right on. Very cool. That's awesome.
We'll bridge all that.
That's a good example. I
Like
like
the
it.
stuff.
Connect all
Figuring
the
out where the
dots.
money's
Yeah, so-
coming from.
You actually already said what your intention is here at Health, which is very impressive, because most of us just come to drink. Apparently, I don't really know.
Do the talk show.
You have a real intention, and I want to hear more. I want you to come back and tell us eventually, like, what you find, where the innovation is happening.
Yeah,
who's
where
investing.
is
Let
the
us know
innovation?
when you find out. Do come back and let us know. That's really important. But before we run out of time here, tell or give your message to our, again, millions of loyal fans. What else, what should they know? What else would you like to share with them?
So I think it's all about collaboration. Let's work together, right? Like in Center, right? You guys, there are different partners throughout the ecosystem. Let's work together to help these guys get from, I've got a Medbridge, I got a great solution, but getting from where I am today into that patient care is going to take all of us. So let's collaborate, let's work together, let's figure that out.
Yeah.
There's plenty, right? So total healthcare costs, the market is enormous, but market innovation and how we're going to do that. But let's work together.
Awesome.
Love it.
Yeah,
Love
and unfortunately, we have to tell you, if you do believe that your better product will get into 1,000 new hospitals next year, it is not going to happen. You need to work with someone like Bluebird to make that happen. And it's not going to happen that quickly, but it's still important to try.
The best product doesn't win. I'm just going to answer that for you.
Product doesn't win.
Yeah, just in
Best
case
product
anyone was
doesn't win.
confused.
Thank
All right.
you so much.
Thank you,
so
Carey. It's a
much.
pleasure to meet you.
Thank you.
Yeah.
Thank you.
Yeah,
All
awesome.
right.
All right, loyal fans.
Holy smokes! What a show! Like, what amazing guest.
Okay,
though,
Melissa
actually.
made me like cross my legs weirdly, and this leg is asleep.
Uh-oh.
I just want everybody to
Uh-oh.
know. I might have to go wear pants. Melissa's telling us to say bye.
Oh,
Okay,
I was just
goodbye.
wondering
What's going on?
Goodbye, everyone.
Bye,
We'll
loyal
see
fans.
you in just an hour or so. More shows to come. Amazing guests. Thank you, Melissa. All right, bye.